Greetings, everyone. My name is Ghaith Mansour, a fourth-year pharmacy student at the College of Pharmacy at Al Faisal University, and it's an honor for me to share our research titled Renal Nerve Stimulation as a Potential Electroceutical Therapy for Obstructive Sleep Apnea on the behalf of our team from Al Faisal University and Case Western University. So let me start with a quick story. Like many scientific discoveries, ours began with a bit of coincidence. While investigating renal nerve stimulation as a potential treatment for hypertension, we decided to record an additional variable, which was respiratory rate, out of curiosity. And to our surprise, when we stimulated the renal nerves, we saw a significant increase in respiratory rate. This unexpected finding opened the door to an entirely new idea. Could we use the same therapy to address obstructive sleep apnea? OSA, as many of you know, does not only disrupt breathing during sleep, but also contributes to hypertension and other cardiovascular issues. If we could target both conditions using a single intervention, it could be a game changer for millions of patients worldwide. So today, I'll therefore walk you through how this discovery evolves into an exciting exploration of renal nerve stimulation as a dual therapy for obstructive sleep apnea and hypertension using the Zucker-Fat rat model of obesity associated with obstructive sleep apnea. So let's dive in. What is obstructive sleep apnea? Obstructive sleep apnea is a huge public health concern affecting millions globally. It causes recurrent upper airway collapse during sleep, leading to disrupted sleep, reduced oxygen saturation, and increase in cardiovascular risks and complications. Despite current treatment options such as continuous positive airway pressure devices and surgical interventions, many patients to this day remain undertreated due to discomfort, limited accessibility, or ineffectiveness. So our research aims and explores a novel approach of utilizing renal nerve stimulation as a potential therapy for obstructive sleep apnea. While the role of renal nerves in blood pressure regulation is well documented, their influence on the respiratory functions remain largely unexplored. Our study sought to bridge this gap by investigating ventilation responses to renal nerve stimulation using the Zucker-Fat rat model, a genetic model of obesity associated with obstructive sleep apnea. So let's move to our results. The male Zucker-Fat rat, we used a sodium pentobarbital as the anesthesia, and a flank incision was performed to expose the left renal nerve, as you can see here. Silver bipolar stimulation electrodes were placed around the renal nerve, and a monophasic stimulation was delivered at 5 hertz, zero point 0.5 milliamps, and zero point 0.5 seconds for 30 seconds. Physiological parameters such as mean arterial pressure, respiratory rate, upper airway pressure, tidal flow, airway resistance, and diaphragmatic EMG were also simultaneously recorded, as you can see here. So let's move on to our results as we move on to here. Our findings demonstrated that renal nerve stimulation significantly improved ventilation parameters, with many responses lasting beyond the tested stimulation period. Specifically, as we can see here, renal nerve stimulation induced a reversible reduction in mean arterial pressure, replicating our previous findings in our spontaneous hypertensive rats that we did for our hypertension research. Renal nerve stimulation increased respiratory rate, as you can see here, and reduced upper airway pressure. In addition, renal nerve stimulation also increased tidal airflow while also reducing airway resistance. And most importantly, and lastly, diaphragmatic EMG activity similarly showed a marked enhancement. So collectively, these outcomes suggest that renal nerves are not only critical for cardiovascular function, but also play a central role in respiratory regulation. Clinically, this positions renal nerve stimulation as a promising electroceutical therapy for obstructive sleep apnea and hypertension, offering a minimal invasive alternative to current treatments. While our study demonstrates the efficacy of renal nerve stimulation in a preclinical model, our goal is that the next steps include translating these findings into clinical trials. This would involve assessing safety, optimizing stimulation parameters, and evaluating long-term outcomes in human subjects. Thank you for listening, and I really look forward to presenting this groundbreaking work in person in Dubai at DUPHAT 2025. Until then, thank you very much.